Who gets sleep apnea? It may be your impression that this disorder is limited to people who are older and overweight, such as seen in the picture. Although this certainly is the classic description, in fact, there is a wide variation of patients. Today's outline is divided into 5 parts. Number 1, differences in nations. 2, differences in gender. 3, differences in ethnicity. 4, the influence of weight. And 5, the factor of age. Number 1, differences in nations. The prevalence, which means how many people out of a group have a disease, depends on the definition of the disease. If your definition standard is strict, the prevalence will be lower. On the other hand, if your definition is not as strict, the prevalence will be higher. As an example, in the NBA, what is the definition of a superstar? If your definition is only players who average 30 points per game, a high standard, then you are only including Harden and Beal as superstars. If, however, your definition is 25 points per game on average, a lower standard, then you have 14 superstars. In sleep apnea, a similar situation exists. If your definition of sleep apnea is 5 or more breathing disruptions per hour of sleep, then in North America, the prevalence of this disorder in males is 15 to 30%. However, if you have a more strict definition, such as the addition of daytime symptoms like sleepiness, then the prevalence is about 14.5%. Now that is data from North America. What about Asia? According to scientific investigation utilizing prediction models, the prevalence in Asians is similar, with the estimated high-risk prevalence of 15.8%. In 2019, researchers looked at worldwide prevalence rates and focused on patients between 30 to 69 years of age. While using a strict definition of sleep apnea, 15 breathing disruptions or more per hour of sleep, the global number of sleep apnea patients is estimated at 430 million. These patients are classified as having moderate to severe sleep apnea. Which country has the highest number of cases? In first place, China. Using a lower definition standard, there are 176 million patients in China with sleep apnea. With a higher standard, there are 66 million patients. Number 2, differences in gender. The prevalence in males is about 2 to 3 times greater than that of females. In the above cited paper, using a strict definition, the prevalence in North American males is 15%, whereas their female counterparts has a rate of 5%. However, after menopause, the rates of OSA in women rise. Females also have a slightly different symptom profile. The male bed partner of a female sufferer tends not to realize that the female is having breathing problems at night. In other words, if a wife has snoring, choking, or pauses in breathing at night, the husband tends not to pick up on it. In contrast, if the husband has breathing issues during sleep, the wife notices it. Is this because males are just insensitive in general? I cannot exclude that, but more likely it is due to the fact that females' breathing disruptions in general are less frequent and more brief, likely making it harder to detect to the naked eye. As far as classic symptoms such as snoring, females tend to self-report these at a lower rate. Other gender differences lie in daytime symptoms. For example, females tend to endorse daytime fatigue, morning headache, and depressed symptoms at a greater rate than males. Although the frequency of breathing abnormalities in female patients is lower than males, at an equivalent level of severity, females tend to be more symptomatic, reporting a greater amount of symptoms. Number 3, differences in ethnicity. As I stated above, the country with the highest prevalence of sleep apnea is China. However, China's obesity rates are certainly not higher than other countries. This being the case, why are there so many sleep apnea patients in China? According to research, the answer lies in the anatomy of the upper airway. In a study performed in Hong Kong, looking at 121 ethnic Chinese patients, investigators conducted X-ray examinations of the patient's head and neck anatomy. In non-obese sufferers of obstructive sleep apnea, otherwise known as OSA, the researchers found that their jawbone and upper mandible were shorter, while their soft palate was longer. Additionally, they found out that the tongue base and hyoid bone were in lower positions. All these factors made it easier to develop OSA. In another paper comparing Chinese and European OSA patients, scientists used MRI scanning to examine the upper airway. In patients with the same degree of breathing problems, Asians were thinner, had a smaller neck circumference, possessed a smaller airway, but had larger soft palate volume. Additionally, the shape of the jawbone, otherwise known as the mandible, was different. In short, the characteristics of the Asian upper airway result in a higher natural tendency to this disorder in the absence of obesity. Number 4, the influence of weight. I already mentioned the important contribution of weight to the sleep-related breathing disorder, but given its importance, a few more words are helpful. For one paper, investigators found that if weight increases by 10%, the probability of OSA increases 6 times. This fact also implies that when losing weight, it may not be necessary to lose a large amount of weight before starting to see improvements in breathing, which is encouraging. From another investigation, results revealed that in those who are obese, defined by a body mass index of BMI of greater than 30, the prevalence of OSA was an astronomically high 63%. Number 5, the influence of age. The rate of OSA increases as age advances. This association may be due to age-related fat accumulation in the throat area, or perhaps secondary to changes in the shape of the soft palate with aging. For example, in one study, researchers randomly surveyed people in Spain, and 80% of people agreed to partake in the study. They did home sleep tests and filled out sleep questionnaires. The results? With every 10 years increases in age, the prevalence of disease increased by 2 times. Let's summarize. Number 1, in the whole world, this disorder is very common. Using a strict definition of symptomatic OSA, the male prevalence rate is 15%. Number 2, in regards to gender, there are more male patients than females, but the rate of illness in females is not small, but is quite significant. Number 3, Asians do not need to be overweight to get the problem. In fact, the greatest number of OSA sufferers exists in China. Number 4, weight connection. The heavier you are, the more likely you are to have OSA. Number 5, age connection. The older you are, the more likely you are to have OSA. Thanks for watching today's video. Hope that it was helpful. Goodbye.